Good day, everyone. We are from Group 5 IKK podcast, and today we're going to talk about uterine infection. So before we start, we are going to introduce ourselves. My name is Natalie Yong Hoi Tong, NIM B04198013.
And my name is Loy Tong, NIM B04198002.
My name is Beulah Kuan NIM B04198032.
Okay, so guys, we've learned about uterine infection in class, right? So, and I think the topic caught my attention, and I did some research and reading on my own. So, I want to share with y'all and have a discussion. Are you up for it?
Yes, of course.
Yes.
Okay, let's go. Without further ado, we're gonna start with uterine infection. So uterine infection have three types. The three types of uterine infection we're going to talk about in this podcast is endometritis, metritis, and pyometra. So let's talk about it for one by one. So let's start with endometritis. Endometritis is an inflammation of uterine endometrium. Based on the name, yeah, it's very explanatory. It can be temporary or permanent. Endometritis is a disease reproduction where the incidence rate is quite high, from ranging from 10 to 80%, which 20 to 40% occurs in postpartum cows. Therefore, fertility can be affected by endometritis in two ways, where in a short time or acute endometritis, it will reduce the fertility by extending the interval from childbirth to pregnancy and increasing the number of cervix per conception. While in long time or chronic endometritis, it can cause sterility as a result of changes in irreversible genital organ. It means that the reproduction organ is permanently damaged. That means they cannot have babies anymore. So pus is usually always seen in the uterus in cows with endometritis, but where the pus is a mixture between exudate and mucus. So endometritis is mainly caused by contamination after parturition, or in other words, giving birth. This is because microflora in the uterus changes due to the elimination and recontamination of microbes in the uterus, as there are still small amount of microbes in the uterus that can cause infection. So the next one is pyometra. So pyometra is a uterine infection that is accompanied by accumulation of purulent exudate. That means there's pus in the uterus, with a large amount of pus in the uterus. And another name for pyometra is chronic purulence endometritis, which means pyometra is a chronic form of endometritis. And then last one is metritis. Metritis is an inflammation that involves the thick part or muscle of the uterus.
Oh, then how can we differentiate between pyometra and endometritis?
So the difference between endometritis is where the endometritis has a lesser pus, while for pyometra, the uterus is full of pus and cause the uterine cavity become large. That means the uterine, you can feel, is very distended. And then there's also predisposition factors of uterine infection include dystocia, retention, secundidae, which is also known as a retained placenta. And then season also will affect the uterine infection. And then twin and induction of parturition, ovarian rebound is one of the process of puparium. And then a situation in which allow bacteria to enter. And then milk production, where it increases the prolactin and suppresses the hypophysis axis, which is the hypothalamus axis of the ovary, and then suppress the release of gonadotropin, and then lead to no follicle develop during the luteal phase.
That's right. So the increased progesterone will suppress the immunity in the uterus. As a result, the leukocyte in the uterus remain low, which cause the microbes to grow easily.
Yeah, and lastly, the metabolic disease also one of the factors that can cause uterine inflammation also.
Oh, then what do you all know why the metabolic diseases are one of the factors that can cause uterine infection, inflammation?
I think it's because the ongoing inflammatory and the immune response are associated with dramatic shifts in tissue metabolism. For example, in hypoglycemia or hypocalcemia condition, it causes the body to become more acidic due to the increase of ketone, which decreases the pH and then result in the environment in the uterus being favorable to the growth of microbes. And then also, there are several methods to detect endometritis, but in this podcast, we will only discuss metric check, ultrasound method, and cytology brush. So we'll start from metric check. Metric check is one of the methods to detect endometritis in cows because it's a cheap and a quick diagnostic method. There's 5 categories of vaginal scoring for metric check ranging from 0 to 4. 0 being no pus present indicate no infection in the uterus, while 1 being slight infection as it has debris in the sample of vaginal discharge. 2 and 3 is indicate as endometritis as it has a mixture of pus and mucus in the vaginal discharge, while 4 is indicated as metritis as it is a red it has red color and involves both endometritis and myometrium. So ultrasound has anechoic and hypoechoic parts. The anechoic is part where there's no infection, but hypoechoic is where the infection occurs. So metritis can be detected by assessment of visceral pain by rectal palpation. So when a cow with endometritis undergo rectal palpation, the cow does not experience any pain symptoms. Will have kyphosis, which means pain symptoms include like kyphosis symptoms. But in cow that have metritis, they will show pain symptoms. That means they will have the kyphosis symptoms. Yeah.
Oh, thanks Natalie for explaining about the diagnosis of endometritis. Do you all hear about the embryonic death before?
Yes, I've just read about it a few days ago. So the embryonic death is defined as the death of a fertilized egg or embryo at the beginning of the development of embryo, which is approximately between 7 to 24 days of post-conception. Early embryonic death leads to reproductive failure in animals, resulting in reduced pregnancy rate, slower genetic improvement, and also substantial impact on farm profitability. It frequently happens during day 7 to 8 post-insemination, which is hatching, and week 2 onwards post-artificial insemination, which is implantation.
So any common symptoms that we can observe from the embryonic death?
The symptom of embryonic death can be categorized into 2 types. First is the embryonic death before day 14 post-conception, and in this case, embryos and membranes are quickly adsorbed, and the corpus luteum lysis will be in time, and the animal will get back to estrus normally. On the other hand, the embryonic death after the day 14 post-conception will take longer time to absorb. The remaining embryos and corpus luteum will last longer.
Oh, then what is the cause of embryonic death?
The causes of embryonic death can be divided into infectious and non-infectious category. For infectious causes, it may be sporadic or a herd problem. It may be caused by infectious bovine rhinotracheitis, bovine viral diarrhea, brucellosis, leptospirosis, campylobacteriosis, trichomoniasis, and more. The mycotic embryonic death usually is caused by Aspergillus or mucospecies, which reach the uterus hematogenously and cause abortion in late gestation. So the major attention has often been given to the infectious cause, but not the non-infectious cause. Probably accounts for more than 70% of the cases of early embryonic death. So embryonic death is commonly affected by factors such as genetic, immunologic, inbreeding, sex of the embryo, um, oviduct dysfunction, uterine dysfunction, feed deficiency, and also high milk production and climate.
Ah, I see. Can I know more details for each factor affecting the embryonic death?
Okay, sure. So for genetic, it might be due to the chromosomal aberrations, which are the changes in the chromosome structure or number. For immunologic, it might due to the rejection of the antibodies of the mother to the embryo. And inbreeding increases the embryonic death due to the reduce of the vitality and quality of embryo. It reduces the placentation in sheep. For sex of the embryo, uh, the male's embryo die more often than the females. And for the oviduct dysfunction happen when the decreased function of the oviduct secreting food ingredients and transport, causing the embryonic death. Lastly is the climate. The high temperature and humidity cause heat stress will reduce the concentration of progesterones, affecting the preparation of endometrium for implantation process.
Oh, is there any way to prevent embryonic death?
Yes, so the measurement and management of health status and planning to control infectious disease risk with appropriate boundary and purchase stock biosecurity alongside vaccination programs are essential. A balanced nutrition program helps control losses associated with minerals or vitamin deficiency and poor quality feeds, including moldy grains and forages. The genetic selection and accurate record keeping help to detect and eliminate blood, bloodlines that prove to be carriers of recessive or lethal genes. Appropriate housing and handling facilities decrease the incidence of accidents and provide an environment conducive to health. For successful abatement of heat stress, the environment of cows must be modified to maintain the cow within a normal temperature range. Common approaches including providing shades and fan or sprinklers to improve the ventilation cooling.
I see. That's interesting. Then, do you ever heard about repeat breeder before, and what does it mean actually?
A repeat breeder is actually a cow that has normal estrous cycle, is free from palpable clinical abnormalities, has no abnormal vaginal discharge, is less than 10 years old, has calved at least once, but however, it has failed to conceive after at least 3 or more consecutive inseminations. So in a simpler terms, in case of repeat breeding, cows will come to heat regularly but not succeed to conceive after successful mating. When there is repeated of the estrous cycles at normal intervals, it is probably due to genital catalysis in cow, delay in ovulations, infertile bull, imprecise of artificial time, infection in the reproductive tract, lesion in vagina or cervix, and early embryonic death. When there is repeated of the estrous cycles with shortened intervals, it could be caused by cystic follicles, which is an anovulatory follicular structures that occur in 10 to 30% of dairy cows. When there is recurrence of the estrous cycles at regular intervals with extended cycles, for example, 6 weeks, 9 weeks, it could be caused by silent heat, lack of observations of estrus, and also embryonic death.
Then, do you know what is the causes of repeat breeders?
Yes, the etiology of repeat breeder appears to be multifactorial. The reasons may be genetic, environmental, infections, outer ovarian activities. All these etiological factors ultimately result into either failure in fertilizations or embryonic death that leads to repeat breeding. The major cause of repeat breeding are genetic, uterine infections, artificial insemination, environment, and also ovulation failure.
I see. Then can you explain more detail about the causes of repeat breeder?
Yeah, sure. So in terms of genetics, chromosomal or genetic abnormalities of parents and those defects that occur during the differentiation process may negatively affect the fertility. For example, repeat breeding has been noticed in cows with chromosomal abnormalities as translocations 1/29 or trisomy X. Factors like inbreeding, age gamete also may provoke genetic defects leading to repeat breeding. There also exists breed difference in occurrence of repeat breeding in cattle. As for uterine infections, the uterine environment encourages the normal embryonic development. Hence, any disorder or defects like uterine infections, endometritis, pyometra, metritis, adversely affects the survival of the embryo, causing embryonic death, which is also one of the major reasons for repeat breeding. It also has been noticed that from 3.5 to 5.7% of cows suffering from metritis had repeat eschers. Uterine infections negatively influence the uterine and cervical postpartum involution, follicle development, cause embryo mortality, and repeat eschers rates. So for artificial insemination, any disorder at any actions involving bowel preparation, artificial vagina preparation, semen collection, semen processing, storage, towing, post-thaw handling of semen, incorrect inseminations in relations to stage of eschers may result into repeat breeding. If animals are not inseminated at accurate time, it may cause conception failure. We should inseminate the indigenous cows according to AM to PM rule. For example, if a cow comes in heat in the morning, she should be inseminated in the same day, evening, and if came to heat on the evening, she should be inseminated on the next day morning. The exotic or crossbreed should be inseminated in mid to late heat. It is better to give double inseminations and should always be done with the gap of 12 to 24 hours after first artificial insemination in crossbreeds. So lastly, for ovulations failure, the problem of ovarian cysts in dairy cows is a serious reason of reproduction failure. Cystic ovarian degenerations is a cause of repeat breeding in cattle. Delayed ovulations and eschers are also linked with this problem. Luteal inadequacy resulting into progesterone deficiency may provoke repeat breeding syndrome.
Wow, that's so cool.
Yeah. Okay, that's all from us. Thank you for listening and goodbye. Bye-bye.